bringing in private entities to partner with the state to develop a medical college, to establish a medical college on PPP. Completely different. No hospital given, nothing. But at the same time, look at how many seats would have come to the states and the access to the teaching hospital in respect of treatment for all the patients who will be referred to the hospital. And therefore, now, we did not stop there. We kept on working and working. One day when we had a program which was graced by the then Honorable Union Minister Ghulam Nabi Azad under the regime of UPA government. We discussed this issue, reminded him, "Sir, do you remember my request?" He said, "Mukul, I was Chief Minister of Jammu and Kashmir. I can easily understand your problem." Then we discussed. Then he called me to Delhi. Then we discussed again. He said it's a brilliant idea to leverage upon the existing district hospitals and referral hospitals, because these are already infrastructures available with every state. He came up with a cabinet memo. The Union Cabinet approved it. He informed me, "Mukul, I'm giving you one." I said, "Why are you giving me one? You know my problem. If I have one in eastern region, I have to have one in western region. You know the whole political dynamics of the state." He said, "Mukul, see, this has been already approved by cabinet. Cabinet has said that Meghalaya also should be given only one. I propose two." But the fact is that we were able to have a breakthrough. Now, to be able to convince government of India, and every state has benefited today. Look at the record. How many states have leveraged upon one after another. We are stuck with Tura Medical College, just one. Because after the change of the government, I don't know, for whatever reasons, the whole delay, the whole dislocation. I do not like to blame anybody, but then it is a fact. Why we did not pursue and complete? Because I promised my colleagues also at that point of time that after Tura Medical College, look at we will do in Riboy. We did share this. Today, Riboy, you have medical college from private sector. Riboy will not be eligible anymore under the criteria, eligibility criteria. Because the criteria says assistance of the union government to the states for establishment of medical college attached to district hospitals or referral hospitals in the districts where there is no government college nor any private medical college. That is the criteria. So therefore, this delay has not only, it's not a question of revolving around the issue pertaining to Tura Medical College. It's an issue which should be dwelt at length from the perspective of the benefit which should have accrued to the state if we would have known with utmost seriousness the need for expediting this program, this project, to complete on time. Now, another part which I want to share before the August House, to again remind us why this program, why this project, if implemented and established as government medical college, the state stands to gain. Disadvantages notwithstanding, disadvantages have been appropriately, exhaustively articulated by people who are protesting. The citizens, the members of civil society organizations, the students, medical students at large from all parts. Both Garos and Khazis and Jaintias, all Meghalaya medical college students are expressing their concern. Because we have to know, I would come to that aspect, but look at where we are missing. What is the program of this government of India? In addition to providing the assistance for the establishment of medical college attached to district hospitals and referral hospitals in the state, in the districts where there is no medical college, either private or government. What are the other benefits? The other benefits is that the government will continue to provide fund for strengthening and upgradation of existing government and central medical colleges to increase the number of MBBS, both undergraduate and PG seats. This is the benefit, extraordinary benefit, which will be accrued to the state. Because after establishment as medical college, it will be eligible for fund, for upgradation, strengthening, to be able to increase the number of MBBS, that means undergraduate seats, and also PG seats. Huge opportunity for our youth who look at this medical sector as one of the most, I must say, revered profession to serve our beloved people. And go beyond the boundaries of our state to serve others and come back with laurels. And look at another one. How Government of India has looked at all the likely challenges. Relaxation in the norms for setting up medical colleges in terms of requirement of faculty, staff, bed strength, and other infrastructure. This is a government policy decision. The NMC is guided by this policy. Because last time when the minister in charge were replying to my supplementaries, she did refer to the stringent norm of the NMC. But today, let this house be informed that the government of India has adopted this particular policy, knowing fully well the challenges of the states. Because the nation does require doctors. Not just the aspirational part of the students or the young men and women who would like to become a member of this medical profession, but at the same time, also the need to ensure that doctors are available everywhere. Just yesterday, Honorable Chief Minister has intervened when we talked about the doctors. Frankly speaking, the gap between the demand and supply is still huge. It will go on increasing as we try to, reach that level where the access to quality health care will be at par with the rest of the developed world, which we are aiming at. We have not reached that stage. But we will have to aim big. We'll have to reach that stage. That's the reason why you require to weaponize these facilities, these programs of Government of India. How we have weaponized the externally aided projects. To see that the funds accrue to the state because of the initiatives that we embark upon more than 13 years back in 2012. So what has been built thus far? Leverage upon it and build more, and sky is the limit, because the aspirations of our youth, the young generation, will only go on surging. It will not be stagnant. Stagnation is bad. Therefore, stagnation is one of the reasons why we get all ailments. Dormancy. We talk about insulin insensitivity because of dormancy. Likewise, our activity in any sector, we have to see if we are stagnating, this stagnation is leading to dormancy. This dormancy, this stagnation has somehow failed the state to leverage upon these benefits. Therefore, it is important to take this advantage and be sensitive to the sentiments and emotions of our people as a whole. People of Garhwals think that this is something which has been given to the people of Garhwals. I remember how one small establishment, Meghalaya Board of School Education, was a bone of contention. Every time there used to be politics on Meghalaya Board of School Education, we overcame that. How? We collectively decided, let's once for all, the issue of Meghalaya Board of School Education be not leveraged upon by any adventurous politicians. And we came up with exhaustive measures, enacted the law, amending the earlier principal law, putting Tura as the headquarters in 2006, putting end to all those pulls and pushes, and the narrative which generated that, okay, somebody is trying to, shift it to Shillong, Meghalaya. All these things have been put to end. Therefore, this particular initiative is also designed to be established in those districts where access to healthcare have huge gap. In terms of the hospitals available as referral centers. Today, we talk about the district hospitals and referrals. These are secondary referral centers. When Tura Civil Hospital is not able to treat any patient, what is the advice to the patient party? Either to either to Negrims or to other private hospitals in Guwahati. Because we are yet to have the tertiary referral hospital in that part of the state. Now, I would like to again refer to another benefit. Where the ministry also provided to enable the states to overcome any kind of challenges associated with establishment of government medical college, enhancement of age limit for appointment, extension, re-employment against post of teachers, dean, principal, director in medical colleges up to 70 years. These are available provisions, which are the concessions. We have somehow or other agreed on putting the retirement age to all the doctors at par with other employees. This is also one issue which should be examined. Because the best of the specialists, best of the doctors, when they are at the peak of their, I must say, brightest part of their career as a medical professional, they retire. And we'll end up having huge vacancy. The resultant retirement at a very young age, unlike other states. This is also one thing, I think it is corroborative, because Government of India has already included this as an integral part of this policy to allow the states to employ. So there are ways and means. And therefore, it is an opportune moment for the state government. I would like to urge upon the Minister in charge of health, take this opportunity. Be positive to the call of the people. Let us be responsive. We have hurdles, I know. We will share these challenges together. We will shoulder these challenges together. Because at the end of the day, what matters for the people must be our priority, nothing else. I know that Tura, means Shillong, we have embarked upon looking at this need to establish the medical college. It is a milestone. It is an achievement. In fact, Honorable Minister of Health informed me about this. I say that it's a great milestone. It's a benefit of the endeavor that you have put forward along with the team. But at the same time, this should not be the reason for being incapable of going ahead with the original proposal, because then we'll end up losing all other benefits. In this program, Government of India also provide support for, again, strengthening the existing government medical college to establish super specialty hospitals. Look at this. This money you will be able to leverage upon only when we have the government medical college. Therefore, the pros are more than the cons. I would also like to link it with from another perspective. Bringing in private investor to place like Tura, a small town. Garo Hills as a region, it's not big enough. It's like bringing the shark into your pond. Like Gualmas, we call, Garos, we call Najek, bringing the Najek to a pond, fish pond. There will be no more space available for our medical professional in the years to come to look at this private sector in healthcare, providing healthcare facilities. They will be only the employees of these private and investors, because the first mover advantage in any form of government, we all know what is the advantage of first mover investor in any field. So, in this crucial sector of health, how bringing in this private investor can really have serious ramification in the whole healthcare sector. It will derail the access to affordable healthcare. Affordable healthcare is there today also, but is it affordable? Well, one night the bill comes to 50,000, 60,000, 1 lakh also. I'm following up. Every day, I think all our honorable members of this, distinguished members of this August House must be all updated on this, because we all have our people who are in hospitals. Can you imagine? Some or other we have gone wrong in many ways, then therefore these corrections are required by creating these facilities, government-owned facilities, by which we can dislocate this trend of increasing cost of healthcare facilities, which is being dominated by the private sector. Otherwise, there is no other alternative. Yes, there is no other alternative. I have done exhaustive due diligence on this. I'm sure all of us must have done it, but we need to continue to engage and exercise our mind collectively. Share whatever we know, because when I listen to others, then I know what I don't know. But if we don't want to listen to others, then we will know only what we know. So therefore, I think it is important to see that we share ideas, we share concerns. Certain things we, hesitate to do, we refuse to do because we know what is going to happen. We know what is going to happen. They are not coming for charity. The private entities, they are not coming for charity. So therefore, the access to quality and affordable health care has become a challenge. I actually cautioned the government after I exited the office about the Meghalaya Health Insurance Scheme, MHIs. Meghalaya being the pioneer. The Honorable Prime Minister wrote letters to all the chief ministers saying that Meghalaya has embarked upon this beautiful program for universal health care through very innovative health insurance program to cover all the citizens of the state. They may emulate. You are requested to examine and emulate this program. But today what has happened? This so-called smart card has become, something which has become a trap for the patient parties. You know how? Because we have not engaged with the hospitals to fix the rate. If we buy something, we have to ask the rate. If I'm paying, I should know what is the price. But we have only fixed what is the amount that will be covered by the insurance, but we have not asked the hospitals how much you will take. We did during our time. We fixed it. So initially when we had discussion with all the hospitals, government hospitals and private hospitals, what happened? When we fixed the rate, we looked at all the input costs, everything, and then therefore justified, okay, how much should be for an operation of appendicectomy, cholecystectomy, etc., etc. Then, keeping that margin of profit, which is considered reasonable, justifiable. Then many hospitals, we had to have repeated meetings after meetings. When some of the hospitals said that we are not willing with this rate, we said okay. But others were willing, we partnered. Then subsequently all others also said, because people with smart card went to hospitals which accepted this smart card. So eventually others also said we will participate. But then predetermined rate was agreed upon. I hope the government will again look at these MHIs also. That's why the cost of healthcare becoming inaccessible. People are surrendering to disease. Therefore, Mr. Chairman, sir, we can have thousands of reasons to agree to this proposal of the people of that part of the state. And challenges are there. I do not say there are no challenges. The Honorable Chief Minister have, to a great extent, articulated all those concerns about the salary. Now, I want to remind ourselves how we engage with Government of India. Over the years, government after government, and during our time we were able to prevail upon Government of India and the Finance Commission. Read the recommendation of the 14th Finance Commission. When the overall quantum of share of taxes transferred to state, as per the Finance Commission recommendation, was limited to 32%, which was increased to 42%, 10% increase. 10% increase. Collective endeavor of the states at that point of time. So this increase has come from 2015-16 onwards. Today the state is, when we approached the Government of India for all those centrally sponsored schemes, when we said it should be 90:10, like earlier government, we were told, no, you are flushed with money. You are flushed with money because the transfer of share of taxes from 32 has increased to 42%. This is the collective endeavor we have already put. You have to, as a government of the day, leverage upon this money. Therefore, there is no question of saying that there is no money. We had that problem where we had that 32% of the share of taxes when it was transferred to the states. But today, since 2015-16, because of our collective endeavor, the Government of India also agreed, the Finance Commission agreed, increased it to 42%. Plus, all the fund which is available through EAPs are able to take care of other things. And another thing, what are the terms of reference usually given to the Finance Commission by the Government of India? Whenever any deficit in matter of revenue expenditure is there, the Constitution provides that revenue gap assistance is recommended by the Finance Commission. The Finance Commission will go into details, the whole expenditure on different hats, and particularly on salary and pension hat. This is the constitutional provision. If you have deficit to meet that revenue expenditure, then the onus of responsibility is vested upon the government, based on which the Finance Commission recommends. You look at the quantum of revenue deficit grant given to other states who had a huge deficit. Ours were less. So one day I was confronted. Why our revenue deficit grant is less? Because we have more revenue. Why Nagaland had 7,000 plus grant for revenue deficit? Because their revenue deficit was more. So this is how the provision of the Constitution operates. We don't beg. I have maintained earlier also, we don't beg. We go for our entitlement. I'm very happy, last Assembly budget session, the Honorable Chief Minister also said the same thing now. We don't have to beg. It is our entitlement. Therefore, if there is a shortage to meet the salary, you have no problem. You will have a hiccup initially, like your battery not igniting, so somebody pushed, you go, reach the destination. That is how the constitutional provision is provided in this vibrant constitution. They have already taken into consideration all these challenges, because in this diverse country, the framers of the constitution, knew how the states will be confronted with challenges, particularly in terms of resources. That's why this whole mandate, every single paisa that Government of India transferred to the state is all mandated by this Constitution of India. Nothing else outside the Constitution of India. Nobody can do this, because there is no charity that anybody can do, nor Government of India can do any favoritism. All those other grants are coming as also covered by this mandate of the Constitution. Therefore, the issue justifying that salary will be around close to 100 crore, it will be. Initially, it will be a little less, but I would like to urge the government, when going gets tough, the tough gets going. So let the government assume upon itself this very principle. It is tough because we are not, state with huge resources. We have constraints. But the whole focus and priority should revolve around the interests of the people, which should be considered, with utmost sensitivity. And in this regard, look at which is the area which is considered as difficult reason to have access to quality health care. Anything to do in deviation of the earlier intent of establishing Tura Government Medical College would only land up in creating unending suffering to our people and will land up in many negative ramifications which will be visible in future, for which we will be blamed. So let we give all that we usually say our best to see that we take cognizance of this as our collective responsibility, and what was considered as due for somebody, it's like children. If we give something to a child to play around, one toy, you take it back, the child will cry. So I think this explains everything. So therefore, I urge the government to see that Tura Medical College is established as a government medical college. Many other things we can discuss, and I have discussed with the Minister in charge of Health. She has said she would like to discuss further. We are always available to discuss and see how we can put our efforts and funnel it together to achieve the objective. With these few words, Mr. Speaker, sir, with all hope and expectation and trust and confidence, I make this submission in the best interest of our people. Thank you, Mr. We know the constraints, we know the challenges, but have we explored all the possibilities? That is one thing. And another thing is that let us not go only by what is in circulation in social media. I think there may be some, some sources which may be circulating certain kind of information, but that is where we need to be more cautious. Because this particular project, again, we have to also look at the background of the project which was conceptualized and how it has been referred to. First thing about that hospital. The whole program for establishment of medical college and the assistance given by Government of India thereof with attached hospitals, district or referral hospitals. These are to start. These are to start with. It is not that these attached hospitals are adequate enough to be a teaching hospital of a medical college. Obviously not. But it is conceptualized in order to facilitate the takeoff. It is only for taking off. Subsequently, the Tura Medical College also will be similar. It has to exit its control over to Tura Civil Hospital. That is the natural transition that will take place. But here, the challenge lies. Medical college is not only for providing education, but a referral center. Now, when the private investor is already, as has been also replied, which is very clear, that once they establish their own hospital as teaching hospital for the medical college, the whole game changes. That is where the concern is. So we have to take cognizance of that. We are talking about an agreement for 33 years. To be automatically renewed for another 33 years, 66 years. By then, I don't know who will be here in this August House, dealing with these challenges, to reconnect the dots as to how the whole background emanated and how it was closed as far as the decision is concerned, as a tie-up between the government and the private entity. So these are areas of concern. Since people are talking about concerns and we are to be receptive. Now the background. See, there is one very important background which I want to make a submission in a very nutshell, Mr. Speaker, sir. We were confronted by unprecedented challenges of lawlessness, terrorism. And after the suspension of operation in 2004, we expected that we will be able to put an end to this whole problem of lawlessness. But somebody left. Somebody deserted, established another, which was then notified as a terrorist organization by the Government of India. The GNLA came out. Somebody from NBC ran out. So, Mr. Speaker, sir, these are concerns. On the basis of that, what we tried to do was that, okay, whatever is the perceived gap in the developmental aspects will be taken care of, and medical college is one of them. We told them that, look, we are already doing this. Look, we are already doing this. Thereby ensuring that we are not somehow subjected to kind of an unforeseen derailment of this whole peace process, and we were able to achieve.
Because, sir, I thought that Elo wanted to talk about other things also. Now he's also started to
go on.
Then I will have to also, sir. I also have to reply, sir. After that, I'm just giving.
So here in this tax settlement,
so I will take my time to reply.
This is reflected. I think CM will have the copy of this, and Honorable Health Minister also should have this copy. These are background, you know. How we restore peace, how we ensure confidence, instill confidence and trust to have a sustainable peace. Therefore, the background is also required to be understood. Therefore, challenges notwithstanding, let us discuss, let us find out. But then, the background is also very important, and therefore, I would like to urge upon the government to see that the original objective of establishment of this medical college is given due weightage, and let this whole objective be not derailed. Derailment I refer to is because of the delay also. Because we delayed. And delay is for whatever reasons we delayed. So these are all contributory factor for what we have come now. But has we explored all the possibilities? Have we explored this particular provision which was referred to by the government policy? Enhancement of age limit for appointment. Was it done? Yeah. So all these things are important, and how we explore all other ways and means of getting faculty members. We have to put together our heads and then see that we overcome this challenge.
So as mentioned, sir, by the Honorable Elo, that all the options, he just mentioned that we should have explored the option of increasing the age limit. We have already done it. We have already increased the age limit to allow the doctors to be able to continue their service, because the number of doctors is less. So we are exploring every possible option. So I even mentioned, I think Honorable Minister mentioned, that we also have explored the option of talking to not-for-profit hospitals to engage with us, to help us and support us so that we can make this functional. They have denied. We have spoken to our own doctors and asked them that would you be willing to come in and join us to run this medical college. And most of them have denied. So that is the kind of situation we face. We've done our homework in the last 3 years. Okay. But yet, sir, we are not going to say that we're going to stop. We will continue to engage. We'll continue to find options. We'll be happy to explore what it is. And the last point, sir, which I wanted to mention about the hospital aspect, which Honorable Elo had mentioned, is that is exactly our point, sir. Today, if this comes up as a government college, now, for example, if Shillong Medical College is there, so the civil hospital will remain to be continued for as long as possible. So therefore the question of us putting up a new hospital from the government expenditure as of now doesn't arise, because we will not have that kind of resources immediately to build up a completely new hospital. So therefore in Tura also, if we do not have this hybrid model, the referral hospital will continue as civil hospital and MCH. We will not get a new hospital, we will not get new manpower there. The doctors who are there already teaching in medical college will continue to be working in the civil hospital, and that system will continue. So the question of a larger hospital coming up will not arise, because the funds are not there.
That provision I have already said during my submission, it is there.
No, this is more becoming like a, I don't know, this is not a short duration discussion anymore.
Sir, they made it long, sir. I have to also reply long.
This provision is there, that's why I'm telling you.
Sir, the provisions, sir, we are going to explore all provisions. I'm not saying we're not going to explore. But it's not as simple as just simply saying that, these provisions. So therefore, there are complications. And as I said, we're happy to engage in this. But I am again reiterating, sir, we have got a huge challenge of manpower, and that is really the biggest challenge in front of us. And I'll be happy if we can get suggestions on how we can move forward.
Rupa Marak, please.
Thank you, Mr. Speaker, sir, for allowing me to take part in this short duration discussion. Moved by Honorable Elo, Dr. Mukul Sangma. It was a matter of pride for the people of Garudas as well as for the whole of the state when the medical college was allotted to Garo Hills, the first medical college. But when the decision comes for the allotting the management of Tura Medical College on PPP mode, it has become a thing to ponder upon, with all of us putting our heads together. Because in comparison, Garo Hills is economically not so much high with Khasi Hills region. So there has been lots of opposition against this proposal for handing over the Tura Medical College to some private entity to manage the medical college. What the concerns are, which I would like to put forward in this August House, that some of the NGOs, the civil society members, and even the senior citizens, they are putting forward their concerns. Their concerns are medical college should be handled and managed by the government itself, because it is constructed, it is started by from the government exchequer. And we have been seeing that in other states, 85% seats are reserved for the students, local students. But here in Tura Medical College, only 50% are being reserved for the local students. That is also a burning topic in these days. And what people are apprehensive are that it may involve high fees in studying there in the medical college if it is handed over to the some private entity to run on PPP mode. Because these private entities are profit driven. They will not come, as stated by the Honorable LO, they will not come here for charity. They will come here for profits. So that is another concern. And the high fees which they will ask from the students from Garo Hills, if that is done, then the students from the not well-to-do families, they will not be able to afford to get their studies in that medical college. I would like to put forward one example. In 2021, in my constituency, Jengjal Subdivisional Hospital was created, and that is also still running under PPP mode. So, it was assured to the people of Jengjal area that it will purely be, it will run on PPP mode, but it will be like any other government hospital. But comparing to other government hospitals, this hospital is charging a bit more than any other government hospitals. So this kind of assurance which the government has given to the people is not there in practical. So I would like to draw the kind attention of the Honorable Minister in charge to look into that matter. And one concern in Jengjal Civil Subdivision Hospital, not even a single birth certificate and death certificate has been issued, because no government MO is there to issue the birth certificate and death certificate. They are still getting their birth certificate and death certificate getting done in Asanang PHC, which is still very far from Jengjal. So please take note of that, Honorable Minister in charge. I have already discussed it with Honorable Chief Minister also when I went to see him, but till today it has not been materialized. So these are the things. Sometimes people from Garo Hills, if such kind of things like Khasi Hills, government is taking over the administration of the medical college, and the sister medical college in Tura is left out, and it is being allotted to run on PPP mode. People feel discriminated sometimes. So we should come together and think about this, so that people should not feel discriminated. Sometimes maybe some serious issues may arise out of it. Only the Khasi Hills are getting the share, bigger share. People from Garo Hills, they always say like that. And maybe this will be another reason to another serious issue in future. So we should come together, we should think on this end. There is already a discussion which has already been taken by some civil society organizations with our Honorable Chief Minister, but unfortunately that discussion was inconclusive. But hope that discussion will take another time, and this matter and the concerns of the people from Garo Hills will be resolved. With this few submission, I would like to resume my seat. Thank you.
Mr. Speaker, sir, thank you for allowing me to participate in this short duration discussion. Mr. Speaker, sir, the short duration discussion was brought forward by Honorable Elo, and he has spoken at length about the issues pertaining to the Tura Medical College, and prior to me, Honorable Member from Dadeng as well. So I just have few points that I would like to also put forward to the Honorable Minister. Now, when the Tura Medical College was announced, I think the people, not just the people of Garo Hills, but the entire state were very excited, very happy to hear the news. It was like a glimmer of hope, because the current situation of medical treatment, especially in Garo Hills, is not very good. We all know that. It's not very good, because if we have any kind of serious ailments, we cannot treat them anywhere, whether it is in Tura or other district headquarters, in other civil hospitals as well, or other private hospitals. Even the private hospitals are very limited in their expertise. So therefore, sir, when this announcement was made, it was definitely a glimmer of hope for everyone in the region. Now, the objective of this Tura Medical College was so that every section of the society would get the benefit of this institution. Accessibility was key. Accessibility to all sections of the society. Now, when this announcement from the government that this college will be operational in a PPP mode, it came as a shock. It came as a shock because nobody was anticipating it, and everyone was expecting it to be run by the government. Now, again, we have to understand, the Honorable Member from Dadeng, he has mentioned about the economical drawbacks of the population in Garo Hills. So therefore, people grew concerned about how financially they would be able to afford treatment and to gain benefit out of a medical college that would be run by a private entity. So therefore, sir, this is one of the major cause of concern. Another point is that regarding the huge investment that the government has already made into the project. It's a huge investment, and the people, they cannot stress this enough, but the investment that has already been made should be directly beneficial to the people. Now, if such a huge after making such a huge investment, if a private partner comes in to readily reap the profits of the infrastructural investment that the government has made, I think that is quite questionable. So therefore, sir, as mentioned by the Honorable LO and member from Dadingri, we are hopeful, we are still hopeful, because a lot of talks are still going on. We are hopeful that corrective measures will be taken by the government, because it is definitely not acceptable by the people, sir. So I would like to urge upon the Honorable Minister as well as the government of the day to take corrective action and bring everyone on board, so that we avoid any kind of unpleasant incidents in the future, so that everyone, not just in Garo Hills, in all parts of the state, can have access to this Tura Medical College and gain the benefits of this institution. So with these few words, I resume my seat. Thank you, sir.